So, good evening and a very warm welcome to all the senior doctors, my dear juniors, and everyone who have joined from different parts of India. We're very happy and very proud that many of you, especially from different states, are showing a great interest in this learning session that we are conducting. You have taken your precious time. That is what we need to value, right? In order to understand, in order to develop, in order to grow in your clinical practice. And for that, it's a huge appreciation from our end to all of you. So thank you so much for joining and a very warm welcome. So as you all can see, today we are going a step ahead and trying to understand how we are going to learn the repertory. Okay, so repertory is one section which is a compass for us, right? Which will show us the direction, especially when we are trying to analyze the cases. So today we are there here in order to understand certain love related rubrics that we have very importantly in our repertory, and we will be trying to understand one after the other. Okay, so before we start the session, so this is the clinical master series that we are conducting. We have already conducted the two sessions in the past. One was on lac caninum and one was on carcinosin. So this is the third session and the next session is on 27th. If you have missed any of the session, it is there on our YouTube channel. You can go back and watch. So before we start the session, we are really very grateful to the founder of this beautiful science, which has given us everything, Dr. Samuel Hahnemann sir. And equally, we are grateful to Dr. Praful Vijayakar sir as well, who has made this science so simplified, who has given us a great hope, especially in our clinical practice, and a small effort from our end in order to spread the knowledge that we have got from all the predictive practitioners from all over India. So, with gratefulness, a warm welcome to our today's chief guest, Dr. Pavitra Ma'am, whose constant support has been really a great value for us in order to, upgrade our clinical practice, our knowledge for everything. Her support was really a great blessing for us. Thank you so much, ma'am, and thank you for being today's chief guest for the session. I hope ma'am will also be sharing wherever necessary. If she can share, she will be sharing many important aspects where and when necessary in the today's session as well. So for whoever are listening to me for the first time, myself, Dr. Shreyans, I have completed my BHMS, SCPH and SCPH Plus. Currently, I'm working as consultant homeopath at Bhavani Homeo Clinic, Bangalore. So this is all about my introduction, and now we will start the first topic of the session. Hope my voice is clear and everything is going smooth. If it's okay, you can raise the thumbs up. Okay. Yeah. Okay. So the first thing we have here, before we jump into the actual topic of the rubrics, right? We need to understand what love is. See, when we use the word love, it has many different meanings to understand, especially from different individuals. For me, love could be a different meaning, and for you, the love could be a different meaning. So today we will try to understand some different facets and try to connect it to our repertory. Okay. So today we are going to discuss one of the most common emotions in human life, that is love. Okay, but when we say love, we are not only speaking about the romance, what you think. So we are speaking about every bond where a person feels connected. It can be a simple bond, the soric bond that begins. A mother who is being connected to the child, a husband to the wife, a daughter to her father. So simple friendship, right? There also there is a kind of love that is building up. So even a person to an idea can also be a love. I love this idea. I have a great idea. I love this idea. A relationship, a memory. I love the memory where we went to a beautiful trip. That also can become a kind of connection. Okay. So that is the need to feel wanted. So when we say the word love, it is not a simple, way of thinking like attraction, okay, belonging or something. So love is the feeling that this person is mine and I am important to someone. So that is how we are trying to understand the love first. Then we will go with the repertory section. So especially what happens, so this is all what I've told, right? What is love? So love in reality is not just attraction between two people, but love is the need for connection, the need to feel, to be wanted, to be accepted. I want to be important, protected, emotionally secure. So what happens when this bond get disturbed is what we need to understand. So when the love is not received, one person can react in a different way while the other can react in a different way. So one can become silent, one can become angry, one can become jealous, possessive, controlling, or one can become even dependent, or if they're very syphilitic, they can go into a destructive nature as well. So that's how we will be even trying to understand the miasms. Okay, so how one person can react in a psychotic aspect, react in a syphilitic aspect is all what we are going to see today. So the event may be very simple and the same for every one of us. It can be a rejection, separation, betrayal, loss, or neglect. But every person reacts differently, is what we are understanding. So that difference is exactly what we see in our remedies and our rubrics as well. Okay, because love is not an emotion, love is a biological need. So that is a need to feel connected, accepted, valued, protected, and there is a feeling that I should not be abandoned. So even that is a main core which is creating this need of love. So what happens when the moment when the mind gets that this especially need, the love for need is threatened, so the body also starts reacting to that, right? So we say that mind and body are in the same sync. So when the mind is getting affected, even the body gets affected. So especially when this basic need is affected, a person may develop skin problem. Okay, so a person who feels rejected may develop even the breast symptoms. So a person who feel abandoned may even develop thyroid problems. Okay, autoimmune diseases, other pathologies, even kidney can get affected when you are having something like a forsaken conflict, right? So that is what we are going to even see today as well. So here, when a person comes to you, we need to understand, right? What is it trying to express? So that's what has been written here. A person can, like, he can express you in different ways. Doctor, I cannot tolerate if he ignores me. Okay, doctor, I know she loves me, but still I need constant reassurance. Doctor, after that betrayal, I changed completely. See, these are the different ways a patient sitting in front of you can express, and that becomes an important tool for all of us. So today we will go a step ahead and we will even try to understand the aspect of even the German new medicine as well. So GNM helps us to understand that behind every love related conflict, there is often a particular organ, a particular tissue, or a particular biological reaction that is involved. So, and at the same time, repertory helps us to understand how the same conflict appears emotionally in different people. So today, as we understood love in short, we are not only studying love rubrics, but we are studying how love can change into pain, how this pain changes into conflict, and how conflict changes into rubric. And finally, how that rubric becomes a disease and a remedy is what we are going to understand. So, by the end of the session, you will not only understand rubrics better, but you will even begin to see the patients in your clinic in a different perspective. And that's the intention. We are trying to, go a bit deeper and see what all we can understand from these rubrics. So when we speak about love, okay, as I told, it is not only an emotion, but it is a basic bonding. It's an attachment, right? So therefore, when there is love, there is also a possibility of pain, because the moment a bond becomes deep, the possibility of separation, betrayal, rejection, or loss can also turn into existence. Okay, for someone, a other person can be an existence. So this is where we need to understand. Okay, so this is why in German new medicine, one of the most important conflict that is understood is the separation conflict. So here, before I directly go into the separation conflict, a small understanding, okay, about the primary germ layers. This is a topic that will be dealt in detail in the embryology that I'll be doing in the workshop. But today, to understand, we are going to understand the embryology in detail. But today, in order to understand the separation conflict, certain conflicts that are necessary, which are connected to the love, I'll be explaining the primary germ layers. So there are three important germ layers. One is endoderm, mesoderm, and ectoderm. Okay. So today we will be trying to focus mainly on the ectoderm. I'll tell you why. So this is where is the focus now. So when I tell ectoderm, ectoderm is a germ layer, and the organs that are especially derived from ectoderm are basically the ones which are having the function of connecting us to the outer environment. Can anybody type in the chat box what are the organs that are derived from the ectodermal origin in embryology? Anybody has any idea? You can type in the chat box. Skin, very good. Skin and hair. Yeah, nice. So what all organs can you think? You can unmute and answer if you want to answer. Hmm? Okay, nails. Okay, lungs. Okay. So in lungs, it is not the entire lung, right? I have told you that in lung also we have two parts. One is the parenchyma and other one is the bronchial and bronchial tubules. So the bronchi and the bronchial tubules are derived from ectoderm. So remember that. Lips, very good. Okay, pericardium doesn't come under ectoderm. Okay. Okay. Eyes, teeth. Okay. So okay, as you are saying, it is the general organ you are saying, but in the entire organ, certain layers of that particular organs are derived from different germ layers. So that's what we are going to explore today. Yeah, you all have given a very good input. We will go ahead and try to understand. So this is what I was saying. When we think of ectoderm, ectoderm is a germ layer that helps the body connect and interact with the external environment. Okay, so the epidermis, for example, the skin, what we are thinking about here, allows us to touch and feel the environment, communicate with the outside world, maintain contact with people and surrounding, and biologically, this layer is very closely related to connection and contact. And that's why we are able to connect it with the love aspect now. Okay. So this is very clear for you, is what I feel. Okay. So when we tell separation conflict, it is not simply being physically away from someone. Okay. It is the painful experience of being cut off from the person to whom we are deeply attached to. This is very important. When you're thinking of separation, that particular person has to be deeply attached. If there is no attachment, if they say, even if that person is not there, I don't mind, then if you're taking the separation conflict, that may not be an apt situation there. Okay, it has to be a deeply attached situation. For example, a child separated from the mother, an woman, okay, who is being abandoned by the man she loves, a person betrayed by someone they trusted. Okay, so these are all certain examples I'm trying to tell you. So the main biological theme here is the person with whom I had the deepest connection is no longer available to me. Okay, this is how the patient presents to you as well. I'm using all these different sentences and trying to explain you because not everybody will come and tell you in the same way. I had a love disappointment and you take this rubric, right? Expressions can be in different ways. So I could have told it in Kannada, I could have told it in Hindi, but we have different people from different places today. So we are keeping it in English. You can try to, translate it in your own mother tongue and try to understand how the patient can present it to you. Okay. So this is the separation conflict we are trying to understand. So can anybody tell certain situations where you can think of separation conflict, like some scenarios, for example, you can narrate? Breakup, detachment from mother. Okay, doctor, can you please repeat? The breakup. Breakup. Detached from the family. Okay, yeah, nice, very nice. Death of loved ones, divorce, separated from the mother. Yes, very good. Divorce. So divorce only if they are attached to. Okay. Yeah. Yeah, doctor, you can answer.
It is from the any loved one, like a cat, dog, or any person, but any another things.
Okay, nice, very nice. Even the pet dogs, everything we can consider. Very nice. Yeah. Okay. That's what you are answering.
Engagement with the places like home, office,
Hmm.
new places.
Places also. Very good. Okay. Hmm. Working in different place away from the home. Yeah, very nice. Okay. Hmm. Death of loved ones, detachment from husband, sending a child to the hostel. Very nice. Okay. So I have made a simple list of situations. As you have told, it's all right. Work away from the home. Yeah, very good. That also can be taught. So a simple breakup in a relationship. Okay. But the relationship has to be very strong. So many of you are answering about divorce, right? So in divorce, many of the time what happens, both of them will have some conflict and then it would have went into separation. Okay. At that time, if they have any attachment still, then think of separation. If it was, willingly they have separated, then please be like cautious while you're using this separation conflict there. Okay. So that's what I'm saying. Break up in a relationship where they had a strong bonding. Yeah, even a loss of a close bond, it could be your own friend. Okay, my own friend. So she's no more with me. So that also can be a separation conflict, separation from the loved ones. As you all told, it can be any situation. So, as many of you was answering a few minutes before, I have made a list of organs that are having ectodermal derived organs. Okay. So, the epidermis of the skin, as many of you told, the mucous membrane of the nose. Okay. Even the mucous membrane is something that has been derived from ectoderm. So, the mucous membrane of the nose is one example that I have taken here. The sensory organs, the nervous system, and even the lining of the breast duct. So these are all the organs that are derived from ectoderm. There are many other organs, but I'm just trying to focus on few and make you understand the conflict. Okay. So first we will be trying to understand the skin. Okay. So skin is perhaps the most beautiful example that we can take here and try to understand. See, we love through the skin. A mother can hold her child against her chest. Okay. So we comfort, protect, and reassure through touch. Touch is something that gives us the assurance, right? So the skin is an organ through which connection becomes physical. So when the loved person is lost, distant is unavailable, the body speaks through the skin. So the woman whose child has gone away, okay, can develop eczema over her chest. So this is a kind of situation we can think of. A person who is having eczema kind of eruptions on the chest region. So for a woman, her child is someone whom she holds close to her chest, right? So any separation there, you can directly question and ask whether there is any separation between her and her child. Okay. So a man abandons his partner, develops eczema over the hand. Okay. A child who longs for the absent mother can even develop dermatitis around the face and neck, because these are the places where one is touched, kissed, or embraced. So these are all the understanding what we are having. Okay. So how a skin manifestation happens in trans is what I have to say. So what will be the conflict of dullness? Okay, we'll go into detail of this, but now I'm going to fill upon the topic that we have taken, the separation conflict and especially the love related. Regarding dermis and all, I will be talking in detail in the workshop, or in the even the self-devaluation conflict what we have. If we have anything to discuss that, I will talk about that. So as I was talking about the tri-miasmatic journey, right, from Sora, how the skin manifestation happens, a simple eczema, simple contact dermatitis, urticaria in the starting stages, not in the stage where there is, breathing difficulty and all. In the starting stages where there is small inflammation, itching, you can think about the psoric manifestation. So next, the psychotic manifestation, where we can see warts, abscess, lipoma. why it is happening here? Because the body is having a fear. I'll talk about fear, how fear rubrics are there in love related rubrics, and how that can cause accumulation. We'll try to understand this. Okay. Syphilitically, like there was a sudden, separation, and the person is so much angry about it. We can think of ulceration there. Okay. Deep cracks, bleeding. So these are all the different manifestations. So skin is what I have taken, and I've tried to show you the tri-miasmatic expression of the body. Okay. So I hope all of you are clear with this. So next organ that we are trying to understand here is the breast. So breast biologically is the organ of nourishing. We all know this, right? So in GNM, there is an important understanding. Breast gland is connected more with the worry and concern for the loved ones as well. So whereas the ductal lining of the breast, okay, being ectodermal, it is connected with separation. So I think we had one case also. So there was a carcinoma developed in the ductal region. So in the reports also you can see where the carcinoma has developed. So the site of development can also give you an indication what is the conflict that is happening here. So if you see any growth that is happening in the duct, especially here we are talking about the breast gland. So when the duct is involved there, it is something that is meant for the nourishment, for the connection to happen. And here we are thinking about the separation conflict. Okay. So therefore, when a mother feels separated from her child, when a woman feels abandoned by her partner, okay, and when there is a deep longing for someone who is no longer emotionally present, the breast ducts may get affected. So this is one situation. So a person can experience different symptoms. So there can be pain, there can be swelling, heaviness, inflammation, ductal changes. Okay. So the deeper and the more prolonged the feeling of separation the person is undergoing, the deeper the involvement of the organs, like the pathology can also go deeper and deeper. So this is one understanding what we have regarding the breast. Okay. So I want to remain connected, but the connection has been broken. So next I was talking about the mucous membrane of the nose, right? So smell is one of the oldest and the deepest way through which human being recognizes the closeness. The smell of a mother comforts the child. The smell of a loved one being associated with safety, warmth, and belonging. So this is all one of the facet what we can think. Okay, I'm talking about the mucous membrane of the nose, not the nose as such. Okay, the outside of the nose you can think for identity, dignity, and all the other aspects. What I'm talking here is about the mucous membrane. Okay, because that is something that is derived from ectoderm, right? So we are trying to connect it and understand how we can correlate with the ectodermal conflict. So I can no longer sense the presence of the person whom I long for. So you can just think of all these aspects when you're trying to treat the disease. So next, very important thing. Have you heard people saying that he's my blood? Like we are blood relatives, right? So blood is also one of the important organ when we think of love related rubrics. Okay, when we think of love related aspects, where to apply this particular rubrics, blood is also one of the important aspects. Because why? Blood is a great nourisher of the body. Why? It carries oxygen, it carries nutrients, right? Food, life to every organ. And we all know, right? Without blood, the body weakens, and in exactly the same way, the love nourishes the mind. So a person feels loved, becomes stronger, more alive, more hopeful, and a person deprived of love can have like certain symptoms like being drained, weak, empty, and lifeless. So this is how we are trying to correlate and understand the organs. So next, a very important organ is the heart. Okay. So can anyone type in the chat box, how are we trying to understand the heart and the love aspect? Okay, already it is written, but if you have anything to add on, how we can think heart as such as an organ to be connected with love? Anybody has any idea? Please type in the chat box or unmute and answer. For the blood to be circulated, for that love to be spread all around, heart is something which is doing that particular job, right? So the heart pumps the blood and it nourishes every single organ, every single tissue. Therefore, symbolically and biologically, it becomes the center of emotion. in our life, right? So whenever there is disappointment in love, betrayal, heartbreak, or the feeling that loved ones was not valued, the heart often becomes involved. So a person can say, my heart is broken, I cannot bear what has happened, and I'm deeply hurt. So these are all certain GNM connections that I have made a list of. So next, yeah, I'm not loved, I'm not given important. So this is all I have told you. Yeah. So now there is another important aspect, that is fear. So fear of losing tends to produce growth. We all know this, right? When we have a particular fear, especially like something that is going to happen tomorrow, I'm anticipating it, right? Okay. Tomorrow, I may or may not have the food that I want. Okay. Every day I'm having my food, but tomorrow I may not get it. So this can create a small fear in me. So that fear can make me undergo a situation where I will go and purchase, where I will collect the food items and store it for tomorrow. So this is how we do, right? So this is the same way our body also responds. Whenever we have the fear of losing the loved ones, the body also tries to create a protection, try to create an accumulative pathology in order to save it. Okay, so the body behaves as if it is trying to strengthen the organ in order to hold more strongly. So one situation that I've told you all about here is about the breast tumor. So in breast tumor, the frightened mother who fears losing her child may develop changes in the breast. So we had one case. I will just simplify this. This was a very young girl. I think she was around 18 or 19 years girl, who was having right side uh, breast tumor. Okay. So adenocarcinoma of the breast was the diagnosis. So we asked her like, what is that fear you have? What is the fear you are having? So one thing she told about is, uh, will I be settled in my life? Will I be able to take care of my, future family? So she is just a 19 years old girl who's still studying, but she's thinking all this. Will I be able to take care of my children? She's not married yet, but still she's thinking so much. So this was the situation. And what rubric can you think here? Anybody has any idea what rubric can you think when we have such situation? A 19 years girl who is sitting in front of us, who is having adenocarcinoma, and she's talking about something futuristic. What rubric can you think here? Anybody has any idea? This and try to understand. So we are trying to make it more interactive. So you can please answer whether it is right or wrong. So what is the function of breast that I was talking before? Typing. What is the delirium anxious future about? Okay, delirium anxious future about. Okay, we'll go to the rubrics. 1 second, doctor. We'll try to understand what is the function of breast. Yeah, the function of breast is to nourish, right? So the nourishment. And what the girl now she's thinking is also on the same line, right? She's thinking, what should I do for my upcoming family? Will I be able to, settled in life? Will I be settled in my life so that I can take care of all of them? So that is the thought. So we are on the same line, right? So nourishment is the organ that has got affected. So, and she's also thinking on the same aspect, nourishing about the future family. So this is one aspect. So connecting to that, connecting to the adenocarcinoma, what rubric can you think? Now you can answer. Delirium is one aspect. Yes. Any other rubric?
Delusion, starvation.
Yes. Delusion. Yeah. So we have one more sub rubric: delusion, starvation, delusion, starve, family will, right? Yeah. So we have this rubric, right? Delusion, star, family will. We have few remedies. Sepia, Ars, I think. So Sepia was given to this girl. So this is an ongoing case. I was just trying to correlate and share with you all. Okay. So the pain and all has come down. We're trying to understand and see the reports. I'll share it with you all a few days after that. So this is how we understand. Okay, delusion, star, family will. So why are we taking delusion here is also something which is very important. So many of you told anxiety, many of you told fear. Okay, but we have went a step ahead and we have converted into delusion. So when we understand the word delusion, it is something that is not there in the reality. So here also, if you see, there is no family, there is no children's. So she has went a step ahead and she's having this fear, a fixed fear, okay, which is not corresponding to the reality. This is how we convert the patient's words into the rubrics, right? We have to be very precise in this aspect. You can think of fear, imaginary things, you can think of anxiety future about, yes, the remedy may be there, but this is how we are trying to narrow down. I'm not saying that these rubrics are wrong, okay? We're just trying to narrow down based on the pathology what we have. How is the body presenting? Okay, so I just feel that this rubric and this situation, the case what I shared with you is like you are able to understand this. Thumbs up. You can share a thumbs up. Yes. Okay. Yeah. So we have many thumbs up. Hope all of you got it what I told. So next, third topic. So we saw what is love. We saw GNM aspect of love, and now we are trying to come back to homeopathy, right? So the tri-miasmatic journey of love-related rubrics, what we have in the miasm. So every rubric has a particular miasm behind it, right? So that is how we are trying to understand. Can you say what are the soric rubrics what we have in our repertory? Can you type in the chat box, unmute and answer? Soric rubrics, simple soric rubrics what we have. Love related rubrics especially. Hmm? Anxiety, affectionate, very good. Yeah, simple, Sora. Elements from love, disappointment, very good. Yeah, a simple element from sad, cares, full of. Okay, yeah, nice. So anyone have still more rubrics to come up with? Sensitive to rudeness. Okay, fine. From the loud ones. Okay, if they are becoming sensitive for the rudeness from the loud ones. Yes, your rubric is right. Sensitive to rudeness. Yeah, nice. So we are talking about love. Yeah, doctor. Clinging. Okay. Hmm? Yeah, you can answer. No issues. 4 seconds. Sympathetic. Very good.
With loved ones. Communicate with loved ones.
Difficult to communicate with loud ones. Okay. Hmm. Neglected, worry, sympathetic. Yeah. So this is all what you are saying, like very nice, appreciative response what we have. So I have just made a list of the rubrics. I'll just show you the gist of it. I cannot go into every single rubric what we have in the Sora, but I've just made a brief understanding so that you can correlate with the other rubrics as well. So as you all know, like if any student is attending the session, so we have three main miasms: Sora, psychosis, and syphilis. To have a very simple understanding, what is Sora? Sora is something that is a basic need. So we need to understand why miasms are important, right? So yesterday, like on the last session, Dr. Padmini was sharing about the miasms. That in the upcoming workshop we will talk about miasms, but you have to need to know what are miasms, right? So that's what I was saying. Sora is something that is the basic need. Okay, it can be anything: food, shelter, your water. Okay, something that gives you energy. Simple thing that we need for our day-to-day survival is what we consider as Sora. Okay, psychosis is something that we want for future, that we want for tomorrow. We try to accumulate. Sora is something where we are trying to accumulate things. Okay, a simple understanding what I'm trying to give you. Syphilitic is somewhere there is a kind of destructive pathology or a destruction in the mind as well, what you are trying to see. So simple, basic need. Psychosis is where there is growth and accumulation, and in syphilis, there is more of destruction. So this is a simple tri-miasmatic understanding what we have: Sora, psychosis, and syphilis. So coming to the chart. Okay, so these are the simple rubrics that I got from the repertory. Elements from love, disappointment, as many of you told. Okay, irritability. Before going into anger, what causes you angry? First, it all begins with the irritation, right? So this irritation can be a basic thing that happens, and then you go into a stage of anger. So expressing your anger because of a loud disappointment. Soric. And love for family, love for children, we have these rubrics. So these are all simple Soric rubrics that we have. Okay. So when it comes to psychosis, can anybody answer what are the psychotic love related rubrics what we have in our repertory? We'll talk about delusions, doctor. Yeah. Can you now answer what are the psychotic love related rubrics what we have? Amorous, fear, betrayed, clinging, suspicious, fear of losing a person. Very nice. Now we are having the fear aspect. So you are able to understand the miasms. Forsaken, jealousy, sentimental. Okay, nice. Any other rubrics you have? Particular rubrics to talk about, especially when it comes to psychosis? Okay. Abandoned. Very nice. Grief. Yes. Grief is one important aspect. Amativeness. Very nice. Sadness. Yeah. This is syphilis. We'll not go into syphilis. Yeah. So as you all told, yeah, full of cares. Okay. So we have fear, delusion, grief, jealousy, amativeness, adulteress. All these are psychotic aspects. Okay. This is what I was trying to say you about. I have a fear of losing someone. See, you have not lost him, but you have a fear that is regarding the future. And you need to protect yourself now only. And this is what happens in psychosis. And that can turn into delusion. The journey from fear to the delusion. Okay. Then grief. Grief is somewhere we will try to see the grief rubrics in detail. Like I will be talking there about the accumulation, what happens inside the body when we talk about the grief. Okay. Jealousy is there. So adulteress, we'll try to see the rubrics, what we have in adulteress and try to understand certain remedies as well. Okay. So these are all certain rubrics that I have made a list in psychosis. And next, we have indifference. This is all syphilitically. So after the fear, after the grief, okay, after having jealousy, the person can give up. Okay, he can go into a stage of being indifferent. I know I don't want this anymore. Okay, I'm not interested in this anymore. A stage of indifference, indolence, being very lazy. Like there is a rubric indolence after love disappointment. We will try to see this. Okay, hysteria, you know, out of proportion. Your actions are out of your proportions. That can be hysteria. And there are rubrics kill desire to loved ones. Okay, cruelty, brutality to loved ones. In this rubric, I think there is a rare remedy, but we have a rubric cruelty, brutality to loved ones. Despair from love disappointment. Perversion. So, what is perversion? Love perversity. So, we'll try to see this. Homosexuality. So, this is one important syphilitic aspect what we have, which is not according to the norms, right? And finally, after all this, the body goes into a stage of death desires or suicidal, where the existence is coming up as we go up, right, towards the syphilis. So this is a simple chart that I have tried to make. I would have missed certain words, certain keywords or rubrics. You can add it in your chart in your own understanding. So this is all about the tri-miasmatic understanding of the love-related rubrics according to its miasms. So we'll start with the rubrics. Everybody is okay. You can give a thumbs up. We will go with the rubric section. Yes. Okay. So all are actively listening and we are very happy for that. So we have a very simple rubric to start with. Elements from love disappointment with silent grief. So this is one rubric. We'll go with the rubric and we'll try to understand the elements from. So where do you think of the rubric element from? Going back to the organ of medicine, you can, if you can remember the aphorism, which number aphorism, you can answer it. Like when do you consider elements from rubrics? Type in the chat box. Acute cases, very good. 5. Yeah, aphorism number 5. Yes, very good. Okay. Yeah. Acute cases are somewhere where we are trying to, yeah, where there is an exciting cause. Yes, very good. Exciting cause is there, and when we are trying to correlate a very simple case, which where you can see the symptoms that are started very recently. So since 2 days, since 3 days, I have these symptoms, doctor. So if somebody comes, you can think of this element from rubrics. Okay. So Yeah, this is what I told you. Yeah. So elements from love disappointment with silent grief is a rubric what we have. Elements from love disappointment unhappy but inclined to laugh. See, hyoscyamus being a hysterical remedy. Okay. There is a situation where there is an unhappy situation, but the person is laughing for that. And that's where we think of the hysterical remedy here. What we have is hyoscyamus. Okay. So elements from love disappointment ending in rage. Again, we have hyoscyamus. Because of love disappointment, there is rage. But we need to even understand these keywords here. When you are thinking of the words like rage, okay. So what is the even body's symptom? Like what is the mind behind the symptom of the rage? What is that symptom that we can expect? Can anybody answer when you're thinking about rage? Hyoscyamus is a remedy, but what is rage? What can you think? What the body presents when you are in rage? Destruction. Yes, very good. So rage is an higher version of anger, right? Yes, doctor.
Bleeding. Bleeding.
Bleeding. Very nice. Yeah. So anger is there. Then rage.
Fractures.
Yeah.
Any fractures?
Mm. Yes, very nice. Fractures. Very good. Then there are many destructive pathologies you can answer now. Ulcerations are there. Gangrene is there. Everything. Okay. So this is all higher end what we are trying to. Yes, doctor. Autoimmunity. Okay. Autoimmunity is something we need to understand. Okay. Rage, if it is towards the self. Okay. I have a loud disappointment and I have rage on myself. Why did I fall into this relationship? I have so much of anger on myself. Okay. Then you think autoimmunity. You are absolutely on the right track. In autoimmunity, it is somewhere the action is on our own immune system, which is trying to protect our body, but that is being now against us. So the gun is pointing towards us. Last time Dr. Padmini was saying this, right? So the gun is towards us. So that is when we think of autoimmunity. Okay. So yeah, as you all told, the destructive pathologist is what we can think when we have the keyword like rage. So now we have another important rubric, elements from love disappointment with sleepiness. So why sleepiness? And we have a very debility based remedy here as well. Phosphoric acid. We'll understand phosphoric acid in detail. We have Metramedica section there. But can you correlate, like, and try to understand why there is, phosphoric acid is having sleepiness? Anybody has any idea? Doctors, sleepiness in phosphoric acid, indifference. Okay, debility is the keyword. Very nice. So in phosphoric acid, there is more of bonding.
Relationship.
Yes, doctor, can you please repeat?
They may be tired in their relationship.
Tired relationship. Very nice. Yeah, this is how we understand, right? They're tired in the relationship and they go into a stage of sleepiness. Escaping mechanism. Very good. Yeah. So I'm learning from you all now. You can answer. It is not that I have to teach you, even you can teach me. So it is all a learning what we have. Anybody has any understanding of phosphoric acid, please share because I will be talking about phosphoric acid later. Yes, yes, ma'am. Weakness due to loss of ATP. Yes, this is very important aspect. Loss of ATP. What is ATP for us? ATP is the basic energy source what we have, right? So how do we get the ATP? From the glucose, right? So again, the love is something which is a basic need for us. Okay. And there is some loss of ATP that is happening and that can lead into weakness. And that's how we can connect it with the love disappointment. So these are all the simple elements from rubric what I have. And next is regarding the then next rubric, anxiety about health of loved ones. Okay. The simple meaning, what does anxiety mean here is the patient is excessively worried, okay, that something may happen to the people they care about. See, here you have to understand, you can't take this rubric for every single person. I just feel that something can happen to the other person. I'm worried about it. No, don't take this rubric anxiety about health of loved ones. It has to be a loved one here. Okay, that's what I'm trying to stress up to the people they care about. Okay, so very often such people are highly sensitive. Okay, the people who come under this remedy are highly sensitive. They're sympathetic, emotionally connected. Okay, they cannot separate themselves from the suffering of the other person. The loved one's illness almost becomes their own illness. So this is a kind of anxiety what they have. So some real life situations I've tried to make you understand I've added. So a woman spends the entire night awakened beside her sick mother. Even a small change in temperature, okay, cough or movement makes her anxious. She keeps chucking again and again, does not sleep, does not eat properly. Okay, all these are some situations. So the patient says you, how can I sleep when she's not well? Okay, if somebody is telling like this, okay, and they are taking care of their loved ones, think of this particular rubric. Okay, so another person says, if my husband has even a small fever, I cannot rest. I keep sitting near him. So what remedies can you think that can come under this particular rubric? I was talking about they're very sensitive, right? Sensitive, sympathetic. What remedies can you think? Don't open the repertory. Causticum, yes. Other one more doctor was answering. Yeah,
Okay.
yeah, you can type in the chat box. Populous, very good. Yeah. Mm. Mm. Okay. So what's about ourself? Okay, nice. Yeah. Mm. Yeah, very nice. Ourself. They have anxiety about their own health. They have anxiety about the health of other people. Yes. Kali carb. Okay. Vanilla. Kali carb. Okay. I told this. Phosphorus. Yeah, doctor. Do we have so many remedies? First of all, in the rubric, we have to check that, right? Do we have so many remedies? Because I have not added the rubrics in my chart. I'll just open and see. So I have made a list as well, I guess. Yeah. Yeah. These are the remedies what we have. Cocculus is there. Okay. Carcinosin is there. Just a second. Yeah. Carcinosinum is there. Heparsulf is there. Merxol and natrum phos. So these are the remedies what I have in my repertory. So in synthesis, anxiety for others, for loved ones, because this is anxiety for others, but we are talking about anxiety about health of loved ones. Okay, so we need to understand this simple difference. So we have cocculus indicus. Can anybody answer how this anxiety develops in cocculus? Cocculus. Anybody has any idea? Yes. Yes.
Like that.
Yeah.
Because they are closely watching and they think they are forgivers and they are going to this person out of the situation.
Hmm.
Because what happens, it becomes a guilt also for them.
Yes. Very nice.
That is how they use it.
Hmm. Yes. So what the rubric we have elements from? One rubric we have there. Ma'am, you told one rubric. We can try to understand elements from night watching, right? Cocculus is there. So cocculus we'll try to understand in short because cocculus is there in many love related rubrics. So I'll just tell you in just okay. Often an unmarried or a childless woman, okay, who lives through caring for others. She suppresses her own wishes, emotions, and needs in order to look after the other family members. So, what is happening here is she is extremely sensitive for others. If someone close to her is unwell, she cannot relax. Okay. She remains alert, anxious, and she continuously watches over them. Okay. She may sit awake throughout the night nursing them. So, there are two strong indications what we have in cocculus anxiety about the health of loved ones and complaints from loss of sleep. So there is one more rubric, I guess, physical rubric, vertigo from night watching. I think somewhere this meaning rubric is there, and we have cocculus there. From night watching, they are having from taking care. Okay, they are having vertigo, and we have used this in one of the case as well. And beautiful improvement was there. So what situation we had here was so the patient she has a grandson. Okay, and the baby is newly born, okay, it's just 1 or 2 weeks, and the baby is crying for the whole night, okay. So her mother is also in a caretaking stage, okay, she is taking the care and she cannot wake up all the night. So here the grandmother, our patient, is being awake all the night and she's taking care, and suddenly one day she is developing vertigo out of nowhere. Her BP is normal, her blood glucose is normal, everything is normal, and she's developing this vertigo. So there we thought of this rubric cocculus, and we had a very beautiful improvement. Even till today there is no other episode of vertigo we could see after giving cocculus. So this is what all about the cocculus. And next we have carcinosin. Who has attended carcinosin can answer. Okay, I should not show this, I guess. Yeah, carcinosin, why they go into anxiety about health of their loved ones. Any idea why carcinosin goes?
The family becomes their extension.
Yeah.
So, don't say another extension. So that is the reason
Mm.
because anxiety.
Yeah, that's one thing. And one more thing, what we told in the last session. What is that in the starting phases that happens?
Anxiety
Anxiety consign? Yeah.
content because of me, it other people should not suffer like that.
Yes, yes. But why that anxiety consigns comes? What is the basic behind that? Why they go into anxiety consigns? Dr. Padmin has told this last time. Why they go into anxiety consigns?
Just love from their
Yeah,
parents.
yeah, need of love. So to get that love, what they do? What they do? Huh?
Jesus.
Yes, people pleaser. Yeah.
Yeah.
And one more thing, responsibility. Many of you have told in the chat box, right?
Early responsibility.
Early responsibility. And because of that early responsibility, we can think of this anxiety getting developed. Okay. So I hope you all have attended the last session of carcinosin. If not, you can go back and attend in the YouTube, right? Hmm. So in carcinosin, the anxiety comes from a deep sense of responsibility, okay, and the need to take care of everyone. They silently carry the burden of the whole family. They may not openly show their anxiety, but internally they are constantly worried. Hepar self is also the remedy what we have. So in Hepar self has anxiety about loved one, especially when there is an acute illness or a danger. So the person becomes very fearful, irritable, oversensitive. So these are all the expressions of hyper self, right? Getting irritable, getting oversensitive. Huh? Small symptoms seems serious to them, and they may develop anxiety for the person who is worsening quickly. So we have next Merksol. Merksol may show anxiety about the health of relatives with restlessness, suspicion, and even a feeling that something is wrong. Okay. So there is more often mental uneasiness, internal agitation rather than self-sacrificing nursing quality what we see in the cocculus. So finally we have natrum phos, the natrum group and the phosphorus. So they are more of nervous type of anxiety. Okay, natrum phos. The person worries, especially at the night or over small health issues of the family members, but the state is not as intense as what we see in the cocculus. So this is the simple understanding what we have. Next, we have a one more interesting rubric. Blackmail, emotional, says you do not love me, especially when refused. Okay, and we have very interesting remedies in this. First, we will try to understand what is the situation and how the patient can present. Okay, so when the person is denied something, attention, affection, permission, company, help, or a wish, which they are longing for. Okay, so they do not express the hurt directly, but in a psychotic way. Okay, they go to a stage of blackmailing. So they try to emotionally influence the other person by saying certain things like, "You don't love me." This happens, right? Many of the times. So if you love me, you would have done that. This is not what I expected from you, right? Nobody cares for me. You are leaving me alone, and they keep on blaming you. Especially many boys would have underwent the situation where the other person keeps on telling you have not done anything, you are very silent, but the other person keeps on telling, if you loved me, this is not the reaction what I expected from you. You don't know what is happening there, and that's the situation what we have. So what are the remedies what we have here? Anybody has any idea? One is the very beautiful remedy what we have. Two remedies are there. One at least pulsatilla. Yes, very good. Yeah. Or else I told it very early. Somebody has told in the chat box. Very nice. Pulsatilla. And one more remedy is there. Don't open the repertory. You can, if you have any idea, you answer. What is the other remedy what we have here with pulsatilla? Or only it is pulsatilla in your repertory? Single remedy? FOS is there. Okay, I didn't get FOS in my repertoire.
Tuberculinum.
Tuberculinum is the remedy. So if you have phosphorus, okay, I didn't have phosphorus in my complete dynamics. Okay, so other one is the tuberculinum. We'll try to understand now. So yeah, this is all what I told. So fear, see what happens is because of this fear, they behave like this. Okay, so at the root there is a fear of being forsaken, emotional dependency, childlike love for the need of the love, insecurity about one's place in the relationship. They are not secure. They are just worried whether this person loves me or not, whether I am still there in his heart or not. Okay, whether he's considering me or not. And this all constant thoughts, that fear of being left alone. Okay, this is what gives rise to this particular rubric. And that's why we need to understand the journey of the remedy as well. And that's what we were trying to do in the previous sessions when we are trying to understand the journey of the remedies. Okay. So when we come to the GNM conflict, especially for this rubric, what can you think? What organ can you think? It's already there. You can type in the chat box.
Kidney.
Kidney. So why kidney? See, we are here in the rubric, there is nothing which is showing you forsaken. Okay. So this is the deeper understanding what we are trying to have here. See, in this particular rubrics, there is nothing forsaken. Okay. It is psychotic. They're blackmailing. But the reason behind blackmailing is how we are trying to connect. Okay. So this is what we try to say as root cause, right? When we have to go to the root always, the basic thing where the problem has started. And that's how we are trying to connect it with the kidneys. So in GNM, a deep fear of abandonment and not being supported are often corresponded with the theme of kidney and the collecting tubules. The feeling of I am alone, unsupported, left to survive by myself. So as you all told, it is pulsatilla and tuberculinum. So pulsatilla, right? We don't have much time to ask you to explain pulsatilla, so I will be telling you in gist. Okay. So what happens is in pulsatilla, there is an inner weakness. We need to understand what is the core of the remedy. Okay. Inability to face the hardness of the world alone. She can't face the world alone. Therefore, she constantly seeks soft, caring, and protective people around her. So this is the basic aspect that is happening in the pulsatilla. Okay, and because of that, all the other manifestations, what you see, the mental picture is what you all know. So one more important remedy we spoke about here is tuberculinum. Can anybody say how we can understand this rubric in tuberculinum? Pulsatilla, we know. 4-second feeling, we can think yielding. In tuberculinum, how can we understand? Any idea? Okay, so I will talk about this. So in tuberculinum, even I was trying to find the source, like from where this particular rubric has been taken and what is the source we have. So in Rajan Shankaran, I could understand few things that I will share with you. The deeper state of tubercular miasm, Rajan Shankaran sir says about tubercular miasm, is that the feeling of being trapped, suffocated, restricted, or emotionally confined. There is an intense need for movement, excitement, change, and freedom in order to survive. So, what happens is in relationships, tuberculinum wants love intensely, but there is also restlessness and dissatisfaction. Okay. So, they may constantly test whether they are loved enough or not. So, unlike pulsatilla, the feeling is not soft and helplessness. Okay. It is more intensity, impulsiveness, dissatisfaction, and emotional turbulence. So, this is how the tuberculinum presents. Okay, so this is a simple remedy differentiation what we have between pulsatilla and tuberculinum. So when we are trying to use such rubrics, even try to understand the journey of the remedy and try to match the journey of the patient as well. Okay, just for the sake she's weeping, don't take pulsatilla. Okay, try to understand whether the journey is matching. She can be a sepia as well in the psoric stage. So this is the simple thing. And next we have a broad section of rubrics in our repertory. that is love disappointment. So there is a situation of love disappointment, and what all can develop because of a disappointment in love is what we are going to understand. So the first rubric we have here is brooding after love disappointment. So brooding, right? What is brooding? How can a patient present when they are brooding? Answer. You can answer in the chat box. You can unmute and answer. How can a patient present when they're brooding? It's already there, written. You can just tell that. Constantly
They'll be thinking or talking about the same
uh,
incidents.
yes. They keep on talking about the same incident. Yes. Anybody else? Hmm? Continuously talk about it with sadness. Very good. With sadness. Yeah, nice. Okay. Yeah. So what happens in brooding is, okay, that after being hurt, okay, there is a disappointment, rejected, abandoned, or not loved back, the person does not simply cry and move on. Okay. Instead, they keep mentally revolving around the same event again and again. So in brooding, which is the key word what we have here in this particular rubric, we need to understand the word meaning of brooding as well. So then we can take this rubric practically in our clinic. So thinking continuously about the same disappointment what they have, replaying the same scenes, words, memories in their mind. So a person can tell, doctor, if I sit quiet for some time or if I'm not occupied with anything, I keep on getting the same thoughts and I keep on thinking about it. This happened. Why did this happen? Why did I fall in love? Why did I undergo this situation? That kind of thought, what they keep on thinking, unable to let go of it. Okay. Remaining fixed in the disappointment for long days, months, and even years. So this is how the person may appear silent, dull, okay, or even absent-minded, withdrawn, but internally the mind is continuously occupied with certain questions. They have the certain questions in their mind which is going on. Why did this happen? Why did they leave me? Especially in love disappointment. So this is what I was trying to talk you about. Sit quietly for a long time, okay, repeatedly being up with the same person or incident, being absent-minded. This is all what I told already. So we have two remedies again here. One is aurum. Okay. First is the aurum. So any idea? The second one is phosphoric acid. Aurum. So aurum's love is a bit different. Okay. So in brooding of aurum, it comes from deep disappointment, mortification, or the wounded attachment. So what happens here is, as we all know, aurum is a remedy for responsibility, duty, achievement, high expectations. Okay. So here the relationship is a bit kind of different. Okay. Aurum metallicum forms a very deep attachment. Often he develops a strong need to guide, protect, or parent the other person. He may become deeply attached to someone younger or dependent. So here what is happening is aurum metallicum forms a very deep attachment. So it is a kind of parent kind of situation. So usually what happens, a girl who is getting married to a very elderly person. So there is around 5 years of gap, 10 years of gap that is happening. So that boy who is looking after her like a parent. I'm a parent and she is my kid, something like that. So that is how the bonding happens because of the responsibility. I need to take responsibility of her. Okay. So this is the words that the patient use. See, I have to take care of her. Phosphorus. I have to be affectionate for her. Like something like phosphorus we have. Okay. But here it is my duty that I have to take care of her. Okay. If somebody is talking in this aspect, think of duty. Okay. Think of aurum. And that is what we have here. And when there is a disappointment in love, we can think of aurum as the remedy. So the other remedy is phosphoric acid. So I told we'll talk about phosphoric acid. So the basic feeling in phosphoric acid is I must care for others, love them, do everything for them in order to be loved in return. So phosphoric acid and ignitia comes very close. If you read Dr. Rajan Shankaran's Soul of Remedies, he speaks differentiating both of these remedies beautifully. So in phosphoric acid, there is more of giving. Okay. I care for others. I love them. And I do everything in order to be loved in return. I should get back what I'm doing. Okay, but when, despite all the efforts, they are disappointed, neglected, or not loved back, they become exhausted. Doctor was talking about exhaustion, right? Dullness, what we were talking about. Debility, yeah. So here we have phosphoric acid. Okay. So that's how the remedy presents itself. Okay. First, there may be a silent grief, disappointment, quarreling, hurt, and they slowly go on losing the energy and they silently start brooding. So this is about the phosphoric. The rubric is there in phosphoric acid. Okay. I wanted to talk about this. So what is happening here is the unequal struggling means that the person is fighting against a situation that is too difficult. Okay. Unequal means the situation is more strong and you have to put extra efforts in order to struggle. Okay. So the situation is too difficult, too painful, too overwhelming for their capacity. Okay. So they struggle. They try to save the relationship. They try to care more. They try to love more. They try to fix things. Okay. But the circumstances are stronger than they are. So the struggle becomes unequal. For example, okay, a person continuously loves someone who no longer cares. The unrequited love. We have ignitia there, right? But here we are trying to understand the phosphoric acid, where they are trying to give continuously when the other person is not loving anymore. The mother tries endlessly to keep the family together, a patient trying to win back the affection of someone who has emotionally left. So, this is the rubric what we have apathetic from unequal struggling with adverse circumstances. So, hope the phosphoric acid, this rubric is clear. So that's what the next presentation, what we have here was the mania from love disappointment. So what is the mania? What is happening here? And here we have the word delirium. So can anybody explain me what is delirium? We'll go with the rubric discussion. Can anybody answer what is delirium? Delirium. There is a delirium that is happening. Confused state of mind. Very good. Yeah. Anybody has, you have used, right, the word delirium in your clinical practice? When you can think of delirium? Confusion state. Okay. False perception is delusion. Okay. Dr. Kanika, you are right. It is delusion, false perception. This is delirium, what I'm talking about. Okay. Reduced awareness. Okay. High fever state. Okay. The body is going out of control. High fever state. Very nice. Uncontrolled reaction. Okay. So, delirium, I will talk about, but
Imaginations.
imaginations. Yeah. Out of control, imaginations. Yeah, imaginations. First, it comes in delusion, then it goes into delirium. Very nice. So we'll talk about delirium now, but to understand in depth, okay, you need to understand the journey. We have a very beautiful journey how a remedy can go into delirium, how a person can go, for example, not a remedy, how a person can go into a delirious state. For that, you need to understand what is the basic sora that has got disturbed, than to the psychosis, than to the syphilis. And in syphilis, we have first psychosyphilis, and then comes the frank syphilis of delirium. So this is the beautiful journey, and we need to understand everything step by step. And this topic in detail, I'll be taking in the workshop. That's what I told you in the last session as well. What are the topics what we are going to take in the workshop? So if you are interested, you can enroll there, and I'll be talking about this in detail. Because as we could see now also, many of you are able to understand the delusions. You are not able to clearly differentiate between the delusions and deliriums, and especially when to take these rubrics. See, even as in starting, even I have done these mistakes. I was not knowing what is delirium, what is delusion, and when to especially take them. For delusions, we used to take delirium. And this is the mistake that I don't want any other practitioner to do. And with that intention, we have included this particular topic in our workshop. Okay, so I will talk about delirium now, but to understand the journey, and many other topics are there, you can enroll for the workshop. Okay, so delirium means, as you all clearly told, so as Dr. Swati ma'am has told, delirium is a continuous state where the person does not understand what is happening, out of control. So here also we have delirium means a disturbed mental state in which the person is no longer thinking clearly or normally. Okay, so they are talking irrationally. They say something that does not make any sense. Okay, becomes confused, behaves strangely. Okay, so this is delirium, but we have another word, mania. So what is maniacal? So maniacal means that the dullness is not dull or silent. Okay, in delirium they are not dull, they are not silent. It is excited, it is intense. Okay, it is excessive, emotional and overactive. So they are having a maniacal, which is excited. They talk rapidly, become excited. Okay, they behave like wildly, which you can't expect, out of control, right? They keep talking about the person they loved. If they are talking about the loved person after alcohol, don't take this rubric. Okay, this has to be a delirium, not because of an intoxication. Okay, for that we have other rubrics. But here we are talking about delirium without intoxication, delirium. Okay, so please don't confuse. So these are all something that I'm telling with caution, with my experience where I have done mistakes, and you should not do the mistakes. Okay, so delirium maniacal is what we try to understand. And any idea what is the remedy we have here? What remedy we have in this particular rubric? Yeah, so this is what I told, the meaning of the word delirium. Stamonium is there. Okay. Yeah, even the mania. I forgot to show the slides, but we have understood both the delirium as well as mania. Okay. So this is all what I told. So delirium maniacal means what? Finally, an excited, emotionally intense, irrational state in which the person has almost lost control after a love disappointment. So in our repertory, we have phosphorus. Okay. Stamonium and sulfur, I have no idea, doctor. The rubric is very clear. Mind delirium maniacal from love disappointment. We have phosphorus, single remedy. Even in complete dynamics as well as synthesis, we have phosphorus. So we all know about phosphorus, right? Yeah. So we'll talk about phosphorus and we'll try to understand. Hmm? So we all know that phosphorus is a very affectionate remedy. It wants affection. Okay. So what happens here in phosphorus? Any idea? Anybody can narrate? It is already there, right? So when in hurt in love, when they get hurt, the mind may become overwhelmed. Okay, instead of quietly withdrawing as if some other remedies, the patient becomes overexcited and emotionally disturbed. And we all know phosphorus is a nerve remedy as well. So even we have to think on these lines. Because we have single remedy here, phosphorus, we need to understand its sphere of action before you consider the rubric and consider the remedy. Especially be careful, especially when you're taking single remedy rubrics. Okay, because that particular rubric may match to your situation. Okay, but the remedy should also match. That's the word of caution what we have here. The patient may cry excessively, speak continuously about the person, becomes hysterical, okay, calls repeatedly. So all these situations are there. The love disappointment is too much for their sensitivity, emotional, affectionate nature. And because they have built their emotional life around the need of love, they feel this loss is unbearable for them. Okay. So this is all about the phosphorus. You know about this. Okay. So next we have another state, which is despair. So there is a incident of love disappointment and the person goes into a stage of despair. So anybody have used this rubric, any rubric of despair? Can you tell how the patient presents in clinic when they are in the despair stage? We were talking about despair rubric in the lac NNM as well. So again, if you want to repeat, if you want to understand how a patient can present, especially when they are in despair stage, you can answer no. It's all over. Despair recovery of the disease. Very good. Hmm?
Given up stage.
Yes. Given up.
They lost. Yeah.
Yes, Dr. Swati, ma'am, you can answer if you want.
I had a patient of eczema.
There is no hope.
One day, that was not actually doing well with my medicines initially. So one day, he with acute exacerbation of eczema happened, and he came, and he told that, "Ma'am, I feel that I don't have any hope in my life, and it is not getting rid of this disease from a long back. So what I'm thinking is, why to bother everyone? I feel like I have to take an another home and just leave everything." That much hopeless he was. He told that, tomorrow I'm going to rent a new house. Then I gave him sepia, and the next day he told, no, no, I'm not going anywhere. I am staying with you.
Okay. Yeah. Very nice. So the case of eczema, right? It was a case of eczema. Yeah. So there, doctor has beautifully used the word despair of the disease condition what he had, and yeah, finally, beautiful improvement is what we can expect when you use these rubrics, and especially the remedies also has to match. And doctor was saying about one important word while she was narrating. It was a stage of hopelessness. I don't have any hope. There's nothing left. Okay. So there is no future. There is no point. I have lost everything. Okay. There's nothing left anymore. If patient is using such words, and even if the pathology, even if the miasm is also matching, don't miss certain rubrics what we have here. Okay. So despair from love disappointment. So here I have made a beautiful chart how despair develops. Actually, this has to come one after the other, but it has come together. So deeply and emotionally, there is going to be a basic stage, psoric stage, where they are attached to a person. Okay. And there comes a situation of love disappointment. Okay. So and because of the love disappointment, they can have like hurt, they will be crying. Okay. They can be angry, confusion, or trying to get the person back. But when none of this work, okay, they try from their end, but nothing is happening. They go into a stage of hopelessness. That is what we call as despair. A simple journey. How the love started, the love disappointment, how the person can express, and finally going into a stage of hopelessness. So we have two remedies, causticum and hyoscyamus. Causticum cares deeply, worries deeply, and becomes strongly attached to the loved ones. So we'll talk about causticum. I have a case also to discuss about causticum. We'll talk about this. Causticum being a very sympathetic remedy. Okay, we need to understand this. And the inner feeling of hyoscyamus, what we have here is there is something wrong within me, and I'm not worthy. Okay, and I will be abandoned. So in one of the Instagram reels, I spoke about hyoscyamus. So what is happening there in hyoscyamus was the person is having an intense fear of being left alone. Okay, and that is how the basic thing develops. Okay, so the inner feeling of hyoscyamus is what we need to understand. There is a feeling that I am wrong, there is something bad in me. Okay, and because of that, people can leave me and I'll be left alone. So as I was saying you, in causticum, it is more about the despair is quite serious and long lasting. Okay, so the patient can keep on saying that after all what I did, how could this happen? Like what all I did for this relationship, but how could this happen? So there was a stage of brooding, but now it has went to a stage of despair. Okay, this is how the evolution has happened. And hyoscyamus is what all I have told you about. He or she won't come back to me now, and I can't do anything to get them back. Yes, very good. Yeah. So we have one more interesting rubric, that is dullness, sluggish from love disappointment. So what is the situation here is the body is becoming dull, sluggish after an incident of love disappointment. Okay, the patient does not become intentionally emotion, restless or dramatic as we can see in other remedies like ignitia and all. But here in this particular remedy, there is a development of dullness, slowness. Okay, they feel heavy and sluggish. Any guess what is the remedy? What remedy we can think? Any idea? If you have used this particular rubric, Phosphoric acid is not. No, not sepia. You can understand from the explanation. Okay, 1 second, doctor. 1 second. There is dullness. We have to find a dull remedy. Okay, we'll try to make it bit interesting. Okay, there is a dullness. The remedy has to be dull. Okay, sluggish, slow, and another side they are sensitive to love disappointment. I think now you can understand the combination of these two. It's a combination, not phosphoric acid. Calcarea phos. Yeah, somebody told calcarea phos. Doctor, yeah, you are right. Calcarea phos. Okay. So yeah, this is the word meaning, dullness, what the dullness means, okay, what the sluggishness means. So we all know this, right? So I'm not going to detail. So the combination is what we have here. Okay. The slow, heavy, and the sluggish quality of calcarea and the emotional, affectionate quality of phosphorus. And calcarea phos is the remedy we have here. So I'm just trying to make this interesting so that you remember it for a long time. Okay. And you can try to recall. Somebody is becoming very sluggish, very dull, not debility. Please try to differentiate debility. We are not talking about debility here. Okay, it is just they are getting dull. And you can think of calcarea phos. Okay. Mm. So next, grief, sorrow from love, disappointment. So yeah, here we have very important understanding. I will talk about the grief first, then we'll talk about the pathologies that we can think because of the grief. So grief is something that remains inside. Please try to understand the word meaning. It is very important. Okay, that remains inside. Okay, it is carried, held, accumulated within the patient. Okay, so the person keeps remembering, thinking, feeling hurt, holding on to the pain. So the grief has the quality of accumulation. So now, can you all think or answer what pathologies can you consider when we are talking about grief with understanding of the meaning? Answer. You can answer. Psychotic miasm. Psychotic miasm. Very good. In psychotic miasm, what pathologies can you expect? Simple. You can tell any medical pathologies. Yes. Very nice. Abscess. Very nice. Yeah. So the word meaning also. Please try to appreciate this. This every word which says that the situation or the pain, whatever the person is undergoing, is remaining inside. Grief is something that is accumulating inside, and hence the body will also reflect in the same way. Okay, the mind of the pathology. So think of this actually when there is a love disappointment, there is a mass, there is a of tumor that is developing. Okay, think of grief, think of accumulation. Okay, so this is why we think of grief is going into a similar state of accumulation. It has all told fluid accumulation, swellings, growths, retention, transformation, congestions. The mind and body will begin to accumulate the same thing. Hope this way of understanding the rubrics is very interesting. Hope all of you are actively listening and I'm not making this boring. So see, we don't have any remedy discussion like how we had last time. So we have to understand the rubrics. And here the word meaning becomes very important. That's why I'm taking the word meaning of everything. So please bear to understand this because when the person is sitting in front of you and when they are narrating, it becomes really very difficult to convert it into rubrics. But if you know the right meaning, okay, the mind does not sorry, something that eyes does not perceive what the mind doesn't know. So the mind has to know, right, in order to perceive through the eyes. So we are trying to understand it and keep it ready. So especially when you have patients in your clinic, you are able to take the rubrics, and that's the intention of conducting this session as well. Okay, so we have hysteria from love disappointment, and the remedy is also there, ignitia. So we all know hysterical. So what is the response? What we can see that after a disappointment in love, the patient develops an intense, dramatic, emotional reaction that is out of proportion and difficult to control. Okay, so the disappointment may be rejection, betrayal, separation, or unreturned love. So there is one more rubric in ignitia, unrequited love. I think tarantula and ignitia are the remedies in that. Okay, so the person is giving. Now, when you can think of unrequited love, I've not taken that rubric in today's discussion, but you can have answered. When we can think of the rubric unrequited love, word meaning of unrequited, can anybody see and answer me? Doctors? Word meaning of unrequited. Unrequited love, we have two remedies, ignitia and tarantula.
Which is one-sided or that doesn't exist. Become
Yeah. So you use the word unfulfilled, right? Something that cannot complete, that they cannot get it. Okay, unrequited. I wanted that, it was my requirement, but I couldn't get it. Okay, that's the stage where the ignitia goes into. There's one more rubric what we have in ignitia. Misunderstood feels, which is not relevant here, but we'll talk about that rubric somewhere. But ignitia is the remedy. That's how we are trying to understand. There is a feeling of that I'm not understood properly. Many of the times patient tell this, and we can think of this rubric actually. So in my clinic also I have experienced people telling he doesn't understands me. You have come across the situation. He cannot understand, doctor. Even if you tell, he cannot understand. Whatever I do, he doesn't understands. It is not that appreciation. We are not misunderstanding it as appreciation. They doesn't want appreciation. They want to be understood. Okay. So we can think of this rubric. Okay. Misunderstood feels and we have ignitia. So I spoke about hysteria, right? Hysteria is that after a disappointment, they can develop an insane dramatic reaction. So next we have, yeah, one-sided love or unfulfilled love. Yeah, very good. Next, we have insanity madness from love disappointment. So, insanity madness means that after a severe disappointment, the patient becomes mentally disturbed. Okay. To such an extent that they lose emotional balance and begin to behave irrationally, wildly, and madly. But insanity madness, we have considered in many sorosyphilitic rubrics. Okay. Where the body is fast progressing. Okay. That is where we are especially focusing and trying to understand upon insanity madness as well. Okay. So we have a single remedy here, that is tarantula. Yeah. So what is happening? A young woman spends year loving someone who never truly loved her back. Unrequited love. Okay. She keeps hoping and giving more. But when she finally realizes that he will never marry her, she becomes emotional. Okay. That is wildly emotional. She cares, she cries, screams, she becomes restless and cannot sit still. She talks continuously about him. So, this is how the presentation can happen. But insanity madness, we can think, especially in sorosyphilitic cases as well. So, consider this miasm understanding. Okay, so we are done with the love disappointment. Now, we are going with one more particular aspect, that is indolence, aversion to work from love disappointment. I think this is the last rubric. So, what is happening here is they have aversion to work. There is laziness that is developing because of a love disappointment, and we have hyoscyamus as a remedy. So indolence does not simply means tiredness. Okay, it means that I don't feel like doing anything anymore. So we'll go a bit fast now. So I think we are done with love disappointment rubrics. Yeah. So now we have company aversion too. When we use the word aversion, okay, what symptoms can you expect when we have aversion? When do you consider aversion rubric? What symptoms can you expect? What pathologies can you expect? Can you type in the chat box? Anybody can answer. Aversion. I don't want this anymore. I don't like this anymore.
it's a kind of denial mode,
Hmm.
hatred,
Kind-
kind of.
yeah.
So
Hmm.
there should be some syphilitic pathologies.
Syphilitic only? Is it like that? Okay. Syphilitic can be there. I'm not saying no, but simple.
Sometimes like detachments and other things.
Yeah, I don't like this anymore. Something I have aversion to that. So the body is trying to also reject it. Somewhere the food, you eat a food and there is a situation of aversion you have, and the body is trying to put it out. Okay. We have thought of aversion rubrics in diabetes cases as well. Very simple, but very simple rubrics. You can enter the case in a simple rubric as well. Okay. So aversion, I don't like that. There in diabetes, we think of resistance conflict. What is resistance? Glucose is already there in the blood. Well, that's what happens in diabetes, right? The glucose is already there in the blood, but it is not absorbed. It is not utilized. I don't want that glucose. So same aspect as well. So next, what we have is company aversion to friends, loved ones, meeting them ameliorates. So initially they have a stage where they are having company aversion. They don't like that person anymore. They don't want to be with that person. But later, after meeting them, they start feeling better. That is alumina. And alumina has an aspect of confusion. Confusion of identity is higher, but the basic confusion. And that's what we can see here also. Initially, they are having aversion, then later they're liking them, ameliorated by that person. So yeah, that confusion was what we can think here in alumina. Then we have company aversion to friends, loved ones that he has offended. He has offended them and he has now company aversion to that particular people. And that shows, the dignity, the duty sense of aurum. And here you can think of aurum metallicum as a remedy. Next, we have company aversion to selfish people, and the remedy is conium. Okay, so these are the sub rubrics what I had, and I've just tried to make a list. You can go back and read the Metra Medica. I'll not go so much in detail as I went in the starting aspects. Okay, so next we have one more important rubric, that is contentious about the objects loved. So contemptuous, I think it's contemptuous for the objects loved means that the patient speaks about, looks at, or treats the people or things he once loved with contempt, scorn, or devaluation. Okay, once he was liking that, but now for that particular loved object, he's developing the contemptuous kind of situation. So looking down upon, speaking with bitterness or scorn, feeling that the other person or the thing is not worthy now. Okay, so this is the kind of situation what we have in contemptuous. So we have the remedy here, that is China. Okay. I don't know if the other remedies are there, but we are focusing on the China. And we know, right, in China, what is happening, there is a feeling of hindered. I'm hindered at work. Okay. So that hinderedness makes them feel that I am weak, I am not good enough, and people hinder me, obstruct, and they persecute me. And this is the reason, like how the remedy begins in the soric stages, and finally they go into a stage of having the contemptuousness for the loud things. So hope this is very clear. Elements from death of loved ones. So this was supposed to be understood when we are trying to understand the basic aspects, right? Elements from death of loved ones. So means that after death of someone, okay, who are emotionally important, the patient starts developing mental or emotional or physical complaints. Okay, so the death is not merely experienced as sadness. The person loses someone who gives them love, who gives them emotional security, support, strength, protection, and stability. See, these words are very important. Okay, and I have a case here now to discuss as well. Please try to understand this, and I will correlate it later. Okay, 1 second. Yeah. So this is what I told. So after loss of that particular person, they can go into a forsaken, unsupported, okay, kind of situation. And even the pathologies can often reflect in the body in the same way. So a separation conflict can be thought of when we think about death of loved one. A loss conflict can be thought of. So a support conflict can also be a thought of. So for example, the back represents support, right? So the spine carries us and keeps us upright. And especially where you have loss of support, L4, L5 disc problems often appears in patient who feels unsupported or whom they have lost a major support in life. So till now I have seen around 3 cases of L4, L5 discompression. Interestingly, in all the 3 cases, we have seen the death of loved ones. Okay, so that is the particular situation what I have seen. Okay, this is my experience. Maybe you could have also seen in your clinic. So we think of self-devaluation conflict, especially when there is discompression. But when we look into the organ, the spine, which is giving us the support, the basic thing that begins here is the loss of support. Okay, so I have seen 3 cases where in first case there was death of father, in second there was a death of relative, and third one death of brother. I have both the cases to discuss now with you all. So this is the kind of situation what we have, elements from death of loved one. So that's the first case I was saying you about, right? After my brother died, I have never been the same. and she developed sleeplessness, sadness, and later she had L4, L5 discompression. And this is a very interesting case. I will narrate it to you in my experience, because for me, certain cases are very close to me because it was during my internship. Okay, in the government college OPD, I got this case. Okay, I was just sitting one day and a lady came to me. She wanted to give her case. I was like, okay, you can give your case. So I had my own way of taking the case. I don't know whether somebody asked her or not regarding what happened before the development of the back pain. What badly she had back pain. She was working in a garments and she was not able to work properly there because of this back pain. And homeopathy was really a blessing for her. She has went to many multiple doctors. I should not use the big hospital names, but she has went to all those hospitals being a garment worker, but she went everywhere, and finally she has come to our government OPD, and we were able to help her, and that was very interesting. And when I asked her what happened before all this back pain complaint started, and she started crying, she started crying, and when she started crying, I could understand, okay, somewhere I'm on the right track, I'm able to take the case. And that was very initial phases of my journey into homeopathy, where I was not knowing much about all the conflicts and all. But I knew one thing, back is for support. Okay, we need to know what we are asking, what questions we are probing to. And that's when the knowledge becomes very important here. Okay. So when I asked that, she started crying and she told my brother committed suicide. Okay, before all the complaints started to me. And that was the entry point. So that case, I have only analysis. We couldn't record anything of the patient because it was a government OPD. So I have taken two rubrics. I will read it if you can't see. Pain general lying while aggravation back on. This was the peculiar symptom what she had. Okay. And the second rubric I took here was elements from death of parent or friends. And the third rubric was just to add it in order to rule out. You can leave that rubric. So Ignitia was the remedy that I got. Okay, her nature, weeping, everything matched, even the thermals, thirst. Ignitia was matching a lot. I was not much confident. I gave her, that time I gave her 3 doses. I will agree with you all. I gave 3 doses of Ignitia 200. Okay. So after that, I thought she may not come back. She will not contact me as well. But very interestingly, after 15 days, she came and she told that one sentence was very close to me, that I went to so many places. If I knew that so much betterment I could get here in this hospital, I would have come long back only, doctor. I went to so many places. And from there, I could understand, okay, now she's feeling better. And this was a very beautiful case, what I had. Okay. I wanted you to analyze, but I directly went with the analysis. So this is one beautiful case. You can think, okay, think even elements from can be thought. I'm not misguiding you all. Aphorisms are always valid. But if you are not getting anything, there is a death of a person, and that is the main entry point you are getting. Please at least try to consider that particular rubric in order to rule out the remedies. Okay. Don't enter if you can't enter from that, but at least try to rule out if that particular remedy is getting affected from the death of the loved ones. Okay. So this is all what we have. And next, one more case. This is also a case where I have taken the rubric elements from death of loved ones. The relative was the one who died here, and she developed sciatica on the left side, I guess. With this particular aspect, there was one more peculiar thing about the patient. She was having so much of anxiety. Okay, you can understand this causticum here as well. So much of anxiety that whenever her husband goes out for some work, she will be restless in the home. Okay, she cannot sit in one place. She takes the phone, she calls them, where are you? When are you coming? Is everything okay? That is the kind of anxiety she's having. And when I was taking the case, her husband told me this. Okay, this is the behavior she has, doctor. This is how she reacts. So, and I went back to Rajan Shankaran sir's Soul of Remedies, and you can clearly see the same sentences which are there in the Metra Medica. And with no doubt, we gave causticum 201 single dose, and you can clearly see her daughter has given a review. She couldn't write much in English. So she told that my mother suffered from leg pain for 2 years. So after trying various treatment without relief, she was not able to walk, do household works. Okay, some of the doctors told that without surgery, she would not be cured. But after visiting, okay, so the homeopathic treatment, I will not take my name, it is homeopathic treatment, okay, which has given significant reduction in her pain, okay, allowing her to walk, manage daily activities. So they are very grateful to the homeopathic system. They have written my name, but it finally goes to the system. There's nothing, because of the system only we are trying to able to achieve all these things. So this is what I really want you all to achieve as well. Okay, try to learn, okay, try to grow. And we have few elements from rubrics, okay, elements from death of father, elements from death of mother, aurum muraticum neonatalum. Recently, if you have attended the session conducted in Bangalore, so you can remember this rubric, elements from death of mother, by Dr. Vijay Krishna sir. Okay, so elements from death of parent or friend, that's what I told now. Elements from death of grandparents, husband, pets, everything we have, everything is there in the repertory. I think few of the rubrics may have rare remedies as well. Just think of it. If it is matching, give that rare remedy also, it will work. Okay, it has to match finally. That's the intention of understanding. Okay, so that's what I was trying. Knowledge becomes very important, and if you are really interested to gain knowledge, I don't have much time to talk about everything. It is already there in the YouTube. So we are trying to conduct a clinical workshop, upcoming clinical workshop, where we are trying to bridge the theory aspect and finally the clinical understanding. Okay, finally the clinical success is what matters to all of us, starting from the embryology. That's what I was talking when we're trying to understand the primitive germ layers. Okay, the embryology and especially homeopathic correlation becomes very important, and this is the part where we are going to go very slow, very basic, especially if you are a student. I can guarantee you from my end, because I will be the one who will be the speaker there. So I will make you understand. Either if the session goes more than the time what we have kept, it's okay, but I will make you understand. That's the commitment what we have towards the system, not for the workshop. It is for the system what we have the commitment for. And if you are interested in learning, we are committed to teach you as well. Okay, so the embryology. Next, how to manage acute and emergency approaches. Acute cases are something which boost your clinical practice, and that's where we need to even have a very good basic knowledge. So case taking in advanced syphilitic cases, okay, where to focus, when to take the mother's pregnancy history becomes very important. When we can think of GCS, when we can think of pathological prescription. So all these things becomes very important, right? So the GNM, what all I have told you about. We have many things to understand in GNM. There are biological laws. If you understand those biological laws, understanding the process, understanding the cases becomes very important. So that will be dealt in detail, converting the patient's language into rubric. Autoimmune approaches. Doctor was asking about autoimmunity. Can we think of autoimmunity in this, doctor? Yes, you can think. But how to think? How to have an understanding of how we approach autoimmune diseases in homeopathy. PCOD and female disorders, which are very common in our clinical practice, are also going to be dealt in. Miasms, especially the basic miasms what we have, psora, psychosis, syphilis. We are not going one single word here and there what Hanuman sir has told us. Everything what is being told, what is there in the aphorism is what we are following, and that is what I am also going to teach you. Okay, so the thought process, the clinical rubrics, why syphilitic miasms becomes very important is also going to be dealt in. Delusions and deliriums difference, as I told. Okay, Metra Medica, we will be trying to understand the tri-miasmatic journey of the prescribed remedies in the cases. I can't assure you that we have 150 remedies going to be taught for you. No, we are not conducting such kind of session. Please, if you are enrolling with that intention that I will be memorized with 150 remedies. No, this is not that kind of course. I will teach you one remedy, I will teach you two remedy, but I will teach you how to study the remedies. That becomes very important. You can study remedies on your own, but how to study it, how should I make myself understand so that I can remember this particular journey for a long time. That is what we are going to understand in the Metra Medica. We will even see the group studies, certain important groups, so that we can try to understand that this person belongs to this particular group. That also becomes important. Herring's law in correlation to embryology is all what you know. Okay, as told by Dr. Vijay Sir's theory of suppression, which is going to be simplified, and we will try to like apply in our own practice and try to give you. So whatever will be taught for you is not something that we are giving you directly from what we have learned. We have learned it, we have tried to apply it in our practice, and finally we are giving it to you. Finally, the organ of medicine. So recently we conducted a similar workshop, but that was only a 2-day session, but now we have 4 days session, which is extended. We have added many more topics. So for that 2-day session, we got a very great response, and we just thought of we need to upgrade and we need to like reconduct this session again. And that's when we have come up with this particular session, which is going to be conducted on 16th, 17th May and 30th and 31st May. If you are genuinely interested, if you want to upgrade your practice, so we have kept the price also very minimal, very, very minimal, 3,000. You can scan the QR code and register as early as possible. Okay. So we have kept the last date for the entire registration as 30th April, but we have very less number of seats remaining. So I think we have around 7 or 8 seats. So if you're really interested, you can complete the registration and take your slot. So with all done, next we'll go with some delusion rubric. Delusion, unfit to be loved. Okay. So this is a delusion of that particular person is unfit to be loved. What conflict does this particular rubric come under? Anybody has any idea? Can you please type in the chat box? What conflict, I'm talking about GNM conflict, can be thought when you listen to this particular rubric, delusion unfit to be loved? Yes, type in, type in. Everybody's there? Nobody's there? Worthless? Okay, very nice. Yeah, yeah, doctor, worthless. Where does worthless come? What conflict does worthless come in? We have a word for that. Worthless comes under which conflict? German new medicine conflict. Self-devaluation conflict. Yes, very nice. It's not ugly. It's ugly is also there, but what is the conflict I'm talking about here? So it is about self-devaluation, right? I'm putting myself down. See, here the person is having a false assumption that I am not fit to be loved only. He doesn't know whether he will be loved or not, but he is having the fixed assumption that I will not be loved. And we have very interestingly germanium met. Okay, so germanium met has so much of self-devaluation. You can go back and read in the Metramedica as well. Okay, weak, inferior, no, not good enough. So that's when this particular thing can happen. And fear, certain fear rubrics are also there. You can go back to the repertory and try to see fear of accident to loved one. I think causticum is there. Okay, fear of death of loved ones, fear of losing loved ones, fear not to be loved. Hmm? And now we have certain syphilitic aspects coming up. Impulse morbid to hurt or harm the loved ones. Okay. See, they love that person, but in an impulsive situation, okay, they go into a stage of hurting them or harming them. And this becomes syphilitic. See, loved one is someone who are very soaring for us. They are our basic needs. Okay. My mother is a very basic need for me. My partner is a basic need for me. They are the Sora. We need them. But you are in a situation where you are hurting them. You are impulsively acting and you are causing harm. And that becomes syphilis. Okay. This is how we are even trying to understand the miasm as well here. So impulse morbid, unwanted, disturbing impulse or urge to injure, hurt, or do something harmful, especially to someone they love about. Okay. So we have even indifference to loved ones. So this is the higher stage in that chart, miasm chart. You could see, right? Indifference was in the top. Finally, giving up. Sepia is what you can think here. Indifference. Okay. So they say that I know I should care, but I feel nothing. Okay. I love my family, but I do not feel connected. I do not want to be with them. It is more than aversion, more than disgust. They are going into a stage of indifference. Okay. So indifference to loved one, but animated to stranger. We have single remedy, that is fluoric acid. I hope it is single remedy. Okay. Uh, so what is the fluoric acid trying to tell in this particular rubric? Okay, we need to understand this. So they feel that the patient, okay, feels that they're trapped in a marriage or a relationship that they don't longer, no longer gives them happiness. That particular relationship no longer gives them any happiness. So the feeling is this relationship is wrong and I need to escape from it. and therefore the patient becomes indifferent to the spouse or the loved ones. So in home, they act like they're indifferent, but their love is animated to the stranger who is outside. So if that kind of situation you have, think of fluoric acid. There are many delusions in fluoric acid, want to dissolve the marriage. Delusion wants to dissolve the marriage. Fluoric acid is there. Think of that. Okay. Love adulteress. Okay. What is adulteress? As I promised you that we are going to talk about adulteress. What is the adulteress? Okay. That means that the person desires romantic or sexual involvement outside the existing relationship or marriage. Okay. It can be a husband or a wife. So the person can already be in a stable relationship, a loving partner, seeking love outside a committed relationship, wanting other partners. Psychosis, right? Already there, but I still want more. And that's the adulterous kind of situation what we have. So we have love exalted. So what does exalted mean? The patient does not experience love in an ordinary or a realistic way. Instead, love becomes exalted, idealized, poetic, sentimental, and almost sacred. So exalted means raised to an unreal height. This is very important. It is very like in the peak. Okay. So idealized, seen as perfect and extraordinary, emotionally glorified. So the patient does not simply love, he idealizes the love. So we have an interesting remedy here, that is antim-crude. We all know, right? When we think of antim-crude, one particular rubric we think is lovesick. We'll talk about that. Okay. So the central feeling why the antim-crude becomes lovesick is what we need to understand. The central theme of antim-crude is the disappointment what they have. Okay. The patient feels they are let down by others, hurt by the reality, disappointed in relationships. Okay. So what happens? He begins to isolate himself emotionally because of all this situation. But instead of becoming completely empty, he creates an idealized inner world. This is not like cannabis indica. Okay. If you can go back to Dr. Rajan Shankar and Soul of Remedies and try to see there in anti-fruit, he has clearly beautifully like differentiated between cannabis indicas uh, situation. Okay, how that goes into a stage of having its own creativity in creating his own world. But here in antim crude it is different. I'll not talk about cannabis indica now, but we'll try to understand antim crude. Okay, so what happens in this inner world here in our antim crude patient is there is an ideal woman. They keep that ideal woman as their uh, person, okay, that they want to love. That is the ideal woman they have, the perfect relationship, what they think about. So he longs for this constantly. So for that, what the patient does, he can write poets, he can go into a poetry stage, thinks constantly about that dream girl, becomes sentimental and emotional, longs for the past or for the love that never really existed. Okay. So we have rubric. Love exalted, moonlighted. We have anti-crude there. So this means the patient becomes especially sentimental or romantic at night under the moonlight. Okay. So moonlight enhances nostalgia, poetry, romantic longing, and idealization. So the patient may sit under the moon, thinks about the loved person, and becomes absorbed in the dreams and longing. Again, the remedy here is anti-crude. So we have love exalted, walking in open air while. So again, we have anti-crude, love sick. So the love sickness develops because the patient has idealized the loved person so much that the reality can never satisfy them. They are going from relationship to relationship because they want to get that ideal woman. They have that standard. They have the standard set. I want that particular love. They can go from relationship to relationship in order to get that particular love. If the relationship disappoints him, he cannot accept it. Instead, he continues longing for the ideal one. So I think we have one more rubric, that is love perversity. Very important rubric. Okay, we have still 34 members actively listening. I'm very happy. I know 5:30 is the time I kept, but it is 6 o'clock. It's okay. 30 members are listening, and I'm very happy for you all. Yes, we have come till here. Love perversity. See, perversity is somewhere, okay, that is not according to the norms, not according to the nature. Okay. The patient's expression of love, emotional relationship, what she has, does not follow the usual, natural, or expected pattern. So, any example can you tell when we can think of the rubric love perversity? You can type in the chat box. When you can think love perversity. Yes, doctors, you can answer. Perversion, it is not usual. When you can think love perversion.
Having more than one sexual partners.
Okay, having more than one sexual partner. Okay, fine. Any other situation? Homosexuality. Okay. Hmm. Okay, one-sided love. Okay. Hmm. Okay. Yeah. Homosexual is one thing. Okay. You're all right. Another situation. Okay. Uh, a situation is there where a girl, okay, a younger girl, she has a brother. She's having an intention or she's having so much of love on her brother, okay, that she wants to marry him. Is it normal kind of situation what we have in our society or according to the nature, normal norms what we have? It's not right, correct? So she is having an love so much that it is going into a stage of perversion out of the norms that she wants to marry her own brother. So if such kind of situation is there, okay, we can think of this particular rubric. As you told, many other things are also there. Perversion, okay, you can think in that aspect, twisted, distorted, opposite to what is expected. This is an example that I have told you from my end. And out of the box, there are many other syphilitic rubrics which I'm not going to talk about, especially homosexuality, pedophile, and certain other things are there. Especially because this video is going to be uploaded on YouTube. And if I explain all those things, my video can get deleted because of the terms and conditions what YouTube has. Okay, with that intention, I am suggesting you all go back and please try to read those particular rubrics also and try to understand the remedies what are there. Okay, I'm not done that intentionally. You can go back and study. So, love perversion expresses love in a strange or contradictory manner, mixes love with cruelty, anger, jealousy, or rejection, be attached to situations that are emotionally unhealthy or inappropriate, behaves in a way that is opposite to the normal affection. So this is all about the love related rubrics session. So we have a YouTube channel, we have WhatsApp group where we are trying to share whatever knowledge we can, Instagram page. If you're really interested, you can please subscribe to our YouTube channel, follow us on all the pages. And really interested people, please, last chance, don't miss. Okay, we may come up with the workshop after 1 year or somewhere like that because we have many collaborative workshop coming up. So please do make the best use of this opportunity and do register. Okay, you can take the screenshot and you can scan the QR code by the end of the session and you can register. Upcoming session is on 27th April, where we will be talking about understanding self-devaluation conflict in clinical practice. So as we spoke about love-related rubrics, we will go now with self-devaluation rubrics. We will take few rubrics, we will try to understand them clinically, apply, make it a very beautiful session. So I request you all to please join the sessions as well. And if you have missed any sessions that we conducted, you can go back to the YouTube channel and watch it. Thank you so much for every one of you for patiently listening to me. So if anybody wants to say anything, if you want to type, you can type in our WhatsApp group. Okay. Thank you so much, doctors, for your patient listening, for interacting with me, for giving me this particular opportunity to share my own small knowledge what I have with you all. Hope this is going to be useful to you all also in your clinical practice. Thank you so much and see you all again on next Monday, 27th April 2026. Okay. Thank you. Bye bye.